Tragic misdiagnosis: how negligent medical care changed my life. Fumi and her husband were overjoyed to be expecting their first child. The journey of pregnancy, however, was not without its challenges. As a first-time mother, Fumi faced the usual physical and emotional adjustments, compounded by persistent health concerns that, unfortunately, went inadequately addressed. During the early stages of her pregnancy, Fumi developed a chronic cough that would not subside. She reported this to her physician during routine antenatal visits. The doctor dismissed it as a normal cough and prescribed over-the-counter cough syrups to manage the symptoms. However, the cough persisted, occasionally accompanied by mild dyspnea, difficulty breathing, which Fumi also mentioned. Again, her concerns were downplayed and no diagnostic imaging, such as a chest X-ray or computed tomography (CT) scan, was performed to investigate the underlying cause of her symptoms. Believing it to be a minor issue, Fumi continued with her pregnancy while managing her cough. But as her due date in December approached, her condition raised no red flags among her caregivers. Fumi's expected delivery date came and went with no signs of labor. Concerned, she and her husband decided to have a scan to ensure everything was progressing normally. The results revealed that the baby was overdue and macrosomic, larger than average for gestational age. The doctor informed Fumi that a vaginal delivery would be high risk and recommended a cesarean section (C-section) to prevent potential complications such as perineal tears or shoulder dystocia. Although unprepared for a surgical delivery, Fumi and her husband agreed, prioritizing the safety of both mother and child. On the scheduled day, Fumi was the 13th patient on the surgical list. The operation was successful, and a healthy baby was delivered. The family celebrated the arrival of their new member, and Fumi was returned to her ward for recovery. Within an hour of returning to her ward, Fumi began complaining of severe chest pain and an increasing inability to breathe. She exhibited signs of acute respiratory distress, with rapid, shallow breathing and visible distress despite supplemental oxygen. The medical team responded promptly, reassessing her condition and ensuring the surgical site was intact. However, no conclusive diagnosis was made. Fumi's condition continued to deteriorate, prompting an urgent transfer to a higher-level care facility for specialized evaluation. By the time Fumi arrived at the referral hospital, she was unconscious, requiring full respiratory support. The receiving hospital immediately conducted a battery of tests, including echocardiography and chest imaging. The results indicated heart failure secondary to an undiagnosed and untreated chest infection that had likely progressed to pneumonia or other complications. Despite her fragile condition, Fumi was placed in an intensive care unit, ICU, and treated aggressively with intravenous antibiotics, diuretics, and cardiac support medications. The medical team monitored her for signs of improvement while maintaining mechanical ventilation. For 2 long months, Fumi remained in a coma, her life hanging in the balance. Her husband and mother alternated between caring for her newborn at home and staying by her side in the hospital. As prayers were said and hopes were kept alive, the medical team worked tirelessly to stabilize her condition. At last, signs of neurological and physiological improvement began to emerge. Fumi regained consciousness, slowly transitioning from a ventilator to breathing independently. The moment she became fully alert, she was overcome with confusion and fear about her surroundings and condition. After Fumi's gradual recovery, a senior physician, curious about the initial misdiagnosis, reviewed her medical records. The revelation was shocking. The persistent cough she had experienced during pregnancy was caused by a severe chest infection that went untreated due to the negligence of her initial care team. Instead of promptly identifying the infection and prescribing antibiotics, the care providers dismissed her symptoms, leading to complications that resulted in heart failure. Worse still, the medications administered during her ICU stay were designed for cardiac failure rather than an infection, unnecessarily subjecting her body to harsh treatments. The long-term effects of these errors became apparent a month after her discharge. Fumi began experiencing fatigue, swelling, and back pain, prompting another hospital visit. Tests revealed that she had developed chronic kidney disease, CKD, a condition likely induced by nephrotoxic drugs used during her previous hospitalization. Fumi's family was devastated to learn that a preventable chest infection had spiraled into life-threatening complications, leaving her with permanent organ damage. Despite the grounds for legal action, they decided against suing the hospital, choosing instead to focus on their gratitude for her survival and the precious gift of her child. Fumi's harrowing experience highlights the importance of vigilant medical care and patient advocacy. Her story serves as a cautionary tale for others to seek second opinions, demand thorough investigations, and never ignore persistent symptoms. Should Fumi's family have taken legal action against the hospital to hold them accountable and prevent similar negligence from affecting others? Or was their decision to focus on healing and gratitude the better path forward? Leave a comment in the comment section below.